Hello everyone, welcome to my channel. This is Kiran. Listen, hope you're all doing well. In today's video, I'll be talking about low back pain fact sheet. So if you like the video related to my health, my way, I would like to request you all, please do subscribe the channel, hit the bell icon and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin, let's go. Low back pain fact sheet. If you have had lower back pain, you are not alone. Back pain is one of the most common reasons people see a doctor or miss days at work. Even school age children can have back pain. Back pain can range in intensity from a dull, constant ache to a sudden, sharp, or shooting pain. It can begin suddenly as a result of an accident or by lifting something heavy, or it can develop over time as we age, getting too little exercise followed by a strenuous workout also can cause back pain. There are two types of back pain: acute or a short-term back pain lasts a few days to a few weeks. Most low back pain is acute. It tends to resolve on its own within a few days with self-care, and there is no residual loss of function. In some cases, a few months are required for the symptoms to disappear. Then it comes to chronic back pain. Chronic back pain is defined as pain that continues for 12 weeks or longer, even after an initial injury or underlying cause of acute low back pain has been treated. About 20% of people affected by acute low back pain develop chronic low back pain with persistent symptoms at 1 year. Even if pain persists, it does not always mean there is a medically serious underlying cause or one that can be easily identified and treated. In some cases, treatment successfully relieves chronic low back pain, but in other cases, pain continues despite medical and surgical treatment. Now, what structures make up the back? The lower back, where most back pain occurs, includes the five vertebrae in the lumbar region, which support much of the weight of the upper body. The spaces between the vertebrae are maintained by round, rubbery pads called intervertebral discs that act like shock absorbers throughout the spinal column to cushion the bones as the body moves. Bands of tissue known as ligaments hold the vertebrae in place, and tendons attach the muscle to the spinal column. 31 pairs of nerves are rooted to the spinal cord, and they control body movements and transmit signals from the body to the brain. Now, what can cause lower back pain? Most acute low back pain is mechanical in nature, meaning that there is a disruption in the way the component of the back, the spine, muscle, intervertebral disc fit together and move. Some examples of mechanical causes of low back pain include the first one, congenital. This first one is congenital. It comes in skeletal irregularities such as scoliosis, lordosis, or you can see, and other congenital anomalies of the spine. Then it comes to spina bifida, which involves the incomplete development of the spinal cord and or its protective covering and can cause problems involving malformation of vertebrae and abnormal sensation and even paralysis. Then it comes to injuries, sprains, strains, and spasms. Then it comes to traumatic injuries such as from playing sport, car accident, or a fall that can injure tendons, ligaments, or muscle causing the pain, as well as compress the spine and cause this to rupture or herniate. Then it comes to degenerative problems, intervertebral disc degeneration, which occurs when the usually rubbery disc wear down is a normal process of aging and lose their cushioning ability. Then it comes to spondylosis, the general degeneration of the spine associated with normal wear and tear that occurs in the joint, disc, and bones of the spine as people get older. Then it comes to arthritis or other inflammatory disease in the spine, including osteoarthritis and rheumatoid arthritis, as well as spondylitis and inflammation of the vertebrae. Then it comes to nerve and spinal cord problems. Spinal nerve compression, inflammation, and or injury. Sciatica, caused by something pressing on the sciatic nerve that travels through the buttocks and extends down the back of the leg. People with sciatica may feel shock-like or burning low back pain combined with the pain through the buttock and down one leg. Then it comes to spinal stenosis, the narrowing of the spinal column that puts pressure on the spinal cord and nerves. Then it comes to spondylolisthesis, which happens when a vertebrae of the lower spine splits out of place, pinching that nerves exiting the spinal column. Then it comes to herniated or ruptured disc. Can occur when the intervertebral disc become compressed and bulge outward. Then it comes to infections involving the vertebrae and conditions called osteomyelitis, the intervertebral disc called discitis, or the sacroiliac joints connecting the lower spine to the pelvis called sacroiliitis. Then it comes to cauda equina syndrome, occurs when the ruptured disc pushes into the spinal canal and presses on the bundle of lumbar and sacral nerve roots. Permanent neurological damage may result if this syndrome is left untreated. Then it comes to osteoporosis. Non-spine sources. Kidney stones can cause sharp pain in the lower back, usually on one side. Then it comes to endometriosis. Then it comes to fibromyalgia. Then it comes to tumors. Then it comes to pregnancy. Now it comes to what are the risk factors of developing low back pain. Anyone can have back pain. Factors that can increase the risk for low back pain include: first, the age. The first attack of low back pain typically occurs between the age of 30 and 50, and back pain becomes more common with advancing age. Loss of bone strength from osteoporosis can lead to fractures, and at the same time muscle elasticity and tone decrease. The intervertebral discs begin to lose fluid and flexibility with age, which decreases their ability to cushion the vertebrae. The risk of spinal stenosis also increases with age. Then it comes to fitness level. Back pain is more common among people who are not physically fit. Weak back and abdominal muscle may not properly support the spine. Weekend warriors, people who go out and exercise a lot of after being inactive all week, are more likely to suffer painful back injuries than people who make moderate physical activity a daily habit. Studies show that low impact aerobic exercise can help maintain the integrity of intervertebral disc. Then it comes to weight gain. Being overweight, obese, or quickly gaining significant amount of weight can put stress on the back and lead to low back pain. Then it comes to genetic. Some causes of back pain such as ankylosing spondylitis, a form of arthritis that involves fusion of the spinal joint leading to some immobility of the spine and have a genetic component. Then it comes to job-related factors. Having a job that requires heavy lifting, pushing, or pulling, particularly when it involves twisting or vibrating the spine, can lead to injury and back pain. Working at a desk all day can contribute to pain, especially from poor posture or sitting in a chair with not enough back support. Then it comes to mental health. Anxiety and depression can influence how closely one focuses on their pain as well as their perception of its severity. Pain that becomes chronic also can contribute to the development of such psychological factors. Stress can affect the body in numerous ways, including causing muscle tension. Then it comes to smoking. It can restrict blood flow and oxygen to the disc, causing them to degenerate faster. Then it comes to backpack overload in children. A backpack overloaded with school books and supplies can strain the back and cause muscle fatigue. Then it comes to psychological factors, mood and depression. Stress and psychological well-being also can influence the likelihood of experiencing back pain. Now it comes to how is low back pain diagnosed. A complete medical history and physical exam can usually identify any serious conditions that may be causing the pain. Neurologic tests can help determine the cause of pain and appropriate treatment. Imaging tests are not needed in most cases but may be ordered to rule out specific causes of pain, including tumors and spinal stenosis. Occasionally, the cause of chronic lower back pain is difficult to determine even after a thorough examination. The first one, blood tests, are not routinely used to diagnose the cause of back pain but might be ordered to look for signs of inflammation, infection, cancer, or arthritis. Then it comes to bone scans, can detect and monitor an infection, fracture, or bone disorder. A small amount of radioactive material is injected into the bloodstream and collected in the bones, particularly in areas with some abnormality. Scanner generated images can identify specific areas of irregular bone metabolism or abnormal blood flow, as well as to measure levels of joint disease. Now it comes to discography, involves injecting a contrast dye into a spinal disc thought to be causing low back pain. The fluid pressure in the disc will produce a person's symptoms if the disc is the cause. The dye helps to show the damaged areas on CT scans taking follow the injection. Then it comes to electrodiagnostic, can identify problems related to the nerve in the back and legs. The procedures. Okay, so that's all about the back pain in this video. I hope you all liked it. I'll definitely come in the next video with my another content. Till then, God bless you. Bye bye and take care.